So, the most important part, anytime you're talking about being a doctor's got two main jobs. Number one job is come up with the right diagnosis. And the number two job is, if you treat that, give them the right treatment options. Okay? So when you're coming up with a musculoskeletal diagnosis, the diagnosis is always based on, what's the number one way you get your diagnosis for musculoskeletal?
History.
Yeah, the history is always going to be it. And specifically, when you're talking about the history, there's different parts. So the number one is the mechanism of injury. So for musculoskeletal, what caused it? When did the pain originate? You know, if they fell down the stairs, then it's not going to be cancer, right? If they fell down the stairs, it's not high blood pressure causing their pain. And you'll know because it's instantaneous. So the mechanism of injury is really important. And then we're also going to look at their symptoms. Like I told you before, positional pain. It hurts in certain positions. It hurts when I do this. It doesn't hurt when I do this. So you're looking at the symptoms, the type, the severity, the location. You know, the nice thing about musculoskeletal, generally when they say it hurts here, that's where the injury is. But there's a few exceptions and they're easy to spot. And then the next one is going to be after you've got the history, which is mechanism, symptoms. And under symptoms, I mean, I would also include, there's a whole bunch of different factors. But the next thing you're going to do is 85% of your diagnosis comes from mechanism of injury. Within a few minutes, you should be able to ask a few questions and rule out all the bad things and have generally a really good idea. You know, if it hurts when I go like this and it hurts right here and it hurts when okay, that's going to be the supraspinatus or rotator cuff tendon. Then after you get what we call the working diagnosis, then you're going to switch over and go into do the exam. And we do a focused exam. So in other words, now that I think it's a torn rotator, I'm going to rule out a couple of these rotators and do one or two tests that's going to tell me it's this rotator cuff. So the purpose of the exam finding is to make sure you're right. I think I know what it is. I'm going to do these tests. I just did a court case where they had what they call an IME. There was a dispute, auto accident, somebody got hurt. The insurance company didn't want to pay, so they hired an expert to examine the patient, and they're a hired gun. Their job is to examine the patient and criticize what the other doctors did and say the patient's fine, there's nothing wrong with the patient. And we won the court case because the examiner did 50 tests and they recorded it, and he looked professional. He was like, I did all these tests, I've got 30 years of experience, I'm an expert. And we were able to make fun of him because 90% of the tests he did were completely irrelevant because he wasn't examining what the history showed was wrong. In fact, we have him on video bragging, I've done the clonus test for 40 years and only found it positive once. And so we were laughing at him because he's doing a test that he didn't expect to be positive. He's done it thousands of times, it's never come back positive. It wasn't even relevant to her case. And then I was able to show he left out the three most important tests. So he spends all his time, and now he looks like an idiot. He's testing everything that he knows is not going to be. He's tested for cancer, he's tested for all these other things. But he's missing the most common tests you would do for the type of injury the patient had, and that's how you ruled out his credibility. So that's what we want. We'll do the exam. This is going to give you a 95% accurate diagnosis for musculoskeletal. You'll know by the time you're done, you're like, I am super positive this is what's wrong. We're going to start with low back pain. That's the most common, and I'm going to use that as an example. But the principles I'm applying apply to shoulders, necks, any joint in the body. We're just going to be talking about the common conditions. So like in the low back or shoulder or neck, you're only going to be dealing with a few structures. So I'm just going to draw a spine. So here's a bone. There's the facet, spinous process, facet up here, and then the bone right here. So there's a vertebra, right? And then you've got another vertebra below, because the spine is really about as complex as you're going to get. There's the spinous again. Okay, not the best. And then here's your disc. And then, so this is a spinal unit, and you've got the bone, disc, and then you've got 9 other supporting. So the disc does about 90% of the work. The disc and the facets kind of do, depending on which level. But you've got an anterior longitudinal ligament in the front, a posterior longitudinal ligament in the back. You have facet capsules around it. There's an infraspinatus. There's a ligament back here. There's another spinal one. There's transverse. You have 9 other ligaments, and they're much, much smaller than the disc. These are tiny ligaments, but the further away from the body they get, they have a big leverage advantage. So you've got a bone, which can bone be a source of pain?
Periosteum.
The bone itself is highly innervated, which is why broken bones are so painful. So bones themselves, but they don't move very much and they're hard to break. They're very, very strong. So the bones can be a severe source of pain. But again, they're very rare when they come into our office, because if somebody breaks a bone, they know it. It hurts. And you'll know them because they don't move. They just want to sit in a chair. Every tiny movement is excruciating because it changes the pressure. The spinal cord's under so much pressure. So the bones can be a genuine source of pain. I see a broken bone, like someone come in with a broken back about every 5 years, 3 to 5 years. And you know it, because they're like, something's really wrong. They can, most people are in pain and can't move well, but these guys can't move at all. And typically they realize that they go to the hospital because the pain is so severe, and they get an X-ray, MRI, and they figure it out. So the next one is, there is a spinal cord right here too. I didn't forget the spinal cord. Can the spinal cord feel pain? Yeah, severe pain. And the way you know it's the spinal cord is because it's radiating pain. So if the patient comes in and says it's going numb down my leg or radiating into my buttock, and sometimes that can be a little tricky because they could have pain in the low back and they have muscular pain in their butt or in their leg. So you'll know because it's traveling pain, it's pain that's positional. So my butt hurts based on when I sit too much, not when I flex it. So if you injure a muscle, the muscle hurts when you move it. And this one will hurt when their back moves, or it'll change positions, or it'll move, or radiate, or travel. So and also sometimes you get other symptoms, so you'll have digestive issues or other things like that. But the spinal cord itself rarely malfunctions, and it's well protected. So typically the only time there's something wrong with the spinal cord is when the disc or a ligament or something else is irritating it or impinging on it, or maybe there's some swelling, localized swelling that is irritating the spinal cord. So the bone is a source of pain, the spinal cord could be a source of pain. You could also have the big muscles of the back could be damaged. So the muscles, there's huge muscles along the back that can be a source of pain, as well as the ligaments. Now, do muscles have a lot of nerve endings in them?
Yeah.
A fair amount, not unusual.
Not as much as the actual nervous system, but
Nothing. Well, that's solid nerves, but yeah, not as much as bone. Bone has more pain nerves in them, and muscles do have some nerve endings, so they can be a source of pain. What about the disc? Does the disc have many nerve endings in it?
not really.
Almost none.
Yeah.
Very few, and it's only on the outer 1/3 of the annular fibers. So a healthy disc really doesn't feel much pain. You could probably stab it with a knife and go, oh, that's uncomfortable. Yeah, it just doesn't have that ability to feel pain. What about the ligaments surrounding it? And ligaments in general, do ligaments have nerve endings?
Not really.
Yeah, very few.
Yeah.
Because they're under so much pressure.
It's tension all the time, so it's like overstimulation kind of thing. You wouldn't want a lot of sensory there.
No, and they're designed to be durable and under high stress. And if you put a nerve ending in a nerve, it's kind of like taking a cable, a steel cable, and sticking your finger in a steel cable. When you put pressure on it, it'll cut your finger off.
Right.
So any nerve endings that would be in a ligament or a tendon when they're under stress would destroy and damage it. Same thing, there's no blood vessels, or very few in ligaments. There's very few living cells, and they're basically just a collagen matrix.
That's why they're a little persnickety to heal.
That's why they don't heal, exactly right. And now there is a sheath around them, and that does have the blood vessels and the nerve endings in them as well. So ligaments are typically not a big source of pain. Same thing with tendons. Like my tendon, I'd snap my Achilles tendon and didn't hurt. It felt like someone kind of hit me. It was numb a little bit, the initial shock, the whole thing snapped in half, and I walked home. I mean, I couldn't walk right because I couldn't use my toe. But were you with me? Yeah,
He was playing basketball.
yeah, I snapped it, but I sat there and kind of laughed about it and went, oh, now I'm screwed, because I knew it snapped, but it didn't really hurt. Because, you know, and same thing with sprains. If a sprain does hurt, because a sprain can be very painful, it's because you rip the surrounding structures too. And those have a lot more nerve endings and stuff. So what bones are going to be really rare. The mechanism of injury is going to be a heavy duty impact or severe. Occasionally, like I did have one person who fell backwards and landed on their butt. Didn't seem like a lot, but it was broken too. So